Hi everyone, it's Arthi again. This is my second time filming YouTube video, and today will be short because I don't have that much to update. And just to start by saying thank you so much for those who are watching. I received unbelievable support after I started this YouTube channel. I am not a YouTuber. I don't have any experience in doing YouTube videos. I am really a novice at this. So it's really meaningful to me that people are watching, and it's amazing the kinds of comments and responses I've gotten. Really so grateful. Thank you so much to everyone for your prayers on this. So having said that, I just want to do a very quick update on this week. So day before yesterday, I had a core biopsy done, and the core biopsy is done on a very targeted area, part of your body, my body, where the cancer is the most active. So the PET scan showed where my cancer was the most active, and I have cancer and tumor in multiple parts of my body, a little bit all over the place, but there is one particular part that has a very active cancer happening right now, and that's the most lit up in the PET scan. So the core biopsy was to take a sample from that part and to really examine it, and pathologists to look at it to determine the exact strains, and that helps them determine the type of chemotherapy that they will give to me. Chemo cocktail, as they call it. Never again think of the word cocktail the same way once you go through chemo. So anyway, that was this week. Fairly straightforward and routine as far as procedures go at Sloan Kettering. Memorial Sloan Kettering is a, really best of its kind in terms of cancer research and cancer care. They have only cancer that they treat. So therefore it's a hospital specialized in cancer. And so they have a very streamlined model. You go in, you are put into a room where you change. The nurse takes all your vitals, make sure that your blood pressure isn't too high, isn't too low, make sure you don't have a fever. They also listen to your chest and make sure that there's no infection or a cold or anything like that. If you have any of those things, then they will either postpone your procedure, or they'll just tell you, if it's like your blood pressure is high, then they'll tell you to sort of take a walk or calm down, and something like that. So none of that happened. Everything was good to go as far as my vitals were concerned. The only thing that was a bit funny, I didn't think it was so funny at the time that it was happening, but it's kind of funny right now when I think about it. And that was that when the nurse took when she put in the needle to do the IV, and that is in case you need a blood transfusion, and also after your surgery, they feed you some fluids in your body. So because the procedure was being done in a high risk area, she had to put in a very thick needle inside, and she did that because of if you have bleeding in a very high risk area of your body, then they have to transfuse large amounts of blood into you. So she used a very thick needle. And when she jabbed at my vein, I have this, you may see this protruding vein in my left arm. When she jabbed at the vein, because the needle was so big and because my vein is quote unquote very healthy, the blood just squirted all over the place. And it was like a water fountain of blood coming out. And this nurse just was not able to control the bleeding. She was kind of panicking and telling me that, this doesn't happen because most of her patients are much older and they have really thin veins, and normally it's very hard to get at it, but in my case it was the opposite, and I have like really fat veins. And so it was blood everywhere. She kind of ran out of the room to get a towel. I was gushing with blood. There was blood all over my gown, and thankfully I didn't have my regular clothes that I had already changed. So all the blood that was all over me remained in the hospital. It didn't get onto my clothes, because the last thing I wanted is for me to come home from this and for my kids to see blood all over me and all over my clothes. That would not have been good. Not because it's any indication of what happened. It's just all that blood just would definitely make my kids panic. So other than that, it was pretty routine. The procedure itself took about an hour to do. And for that, I was given a local anesthetic in the area, and I was given a moderate sedation, which is not the full-blown sedation. You're awake through it, but it really is to make sure that you are relaxed and that you're not moving. Because if you move and if you fidget, then this very targeted procedure that they're doing would be rendered useless. And that's not what anybody wants. So it was, the sedation was pretty cool. It actually felt pretty nice. The nurse said, most people fall asleep during this, even though it's not a general anesthesia. Of course, given my tolerance for these things, I did not fall asleep. I also, if I'm able to, I'd rather stay awake, because I just feel like if I close my eyes, then I'm not going to know what's going on. And anyway, it was fine. I felt completely fine. All I felt was someone was tugging and pulling deep inside me, but other than that, there was no pain. And after the procedure was done, I was put in the recovery room, where they basically monitor you, make sure there's no internal bleeding, and your heart rate is normal, your blood pressure is normal, there's no swelling, and also for the sedation to wear off. The whole process took around 4 hours from start to finish. So now the next step is to wait for the results of the core biopsy, and then my appointment with my oncologist at the end of this week is going to be about what the core biopsy revealed. I already know that I will need chemo, but this will determine what exact type of chemo and really how aggressive the cancer is. And that will help them determine how quickly they have to administer the chemo, what are the sessions, what are the cycles, how often they'll do it, and really what is the exact recipe that they're going to put into my chemo. So all of that will be coming later this week. I'm feeling fairly okay at the moment. Just, trying to manage a bit of what's to come, and anticipating a little bit, but not trying to think about it too much. It's hard not to think about what's about to happen, but at the same time, just thinking about it is not going to help. So I have been, of course, reading and watching Netflix, and also reading more about treatments. One of my Facebook friends told me about CAR T therapy, and amazing stuff. Amazing stuff. It's not first-line treatment yet for diffuse large B-cell lymphoma, but it is the second-line treatment for patients who are either relapsed or refractory, meaning they're not responding to the first-line chemo. Really, CAR T-cell, which is the immunotherapy, is the future. This is where the future of cancer care is going. It will hopefully not be with this extreme toxic chemotherapies that they administer, and it will become much more targeted through even more advanced chemotherapy. We're not there yet, because these procedures are very, very expensive, and they're highly individualized. So it's not offered to everyone. It's only offered to very few who quote unquote qualify. And I don't think I fall into that sort of group of people. And it's really also reserved for older patients who they know can't take chemo. So, you know, if I could, and of course, I'm just a layman. I'm not the oncologist. I'm not a researcher, but just by the sounds of it, it sounds like the way to go. And it really sounds like the targeted immunotherapy and all the CAR T type of therapies that are there are just so much more effective because they are targeted. And it's not like a mass sort of, nuclear sort of warfare on your body. And it's just much more targeted and much more intelligent in that way. But, insurance costs, all those things are playing into it. And there's a FDA in the United States has really limited who qualifies to receive this. So this is the world that we live in. This is the reality. The comfort that I'm getting is that, God forbid I'm in this situation, but if for whatever reason the chemotherapy doesn't work, then there are these advancements that are being made that may help me. Even these advancements, none of these are a walk in the park, because even with these targeted therapies, they're very, very risky, because they are so personalized and they have to create a treatment for you specifically. It also makes it less predictive. Your reactions to it and how your body handles it is very specific, and you are hospitalized the whole time. So, cancer treatment is not a walk in the park, no matter what type of treatment you're getting. It's all pretty shitty. So, let's not kid ourselves into thinking that any of it is easy. It's just when we are talking about things that are sending people into remission, progression-free, and no recurrence of disease, immunotherapy is really where the future is. So I can only hope that these advancements come sooner rather than later, and that patients are, who are being diagnosed now or being diagnosed a few years later, just don't have to go through chemo ever. And it's immunotherapy, and they perfect it by then, and that it's just a much more controlled disease. So on that positive note, that's my video for this week. Sorry for all the background noise. My husband is having a shouting fit in the background, and I told him I'm filming YouTube, but there's life happening outside, which I'm grateful for. So thank you again for watching. Thank you so much to all the people that have sent me your wishes and your prayers. I really appreciate it. Until next time, ciao.